Hi, my name is Colleen Hereditario, and I'm a registered dietitian and the Healthy Food Center manager for Allegheny Health Network. I'm going to be presenting on food insecurity statistics, the Healthy Food Center services, our current outcomes, and the future state of the Healthy Food Centers. The purpose of the Healthy Food Center is to provide healthy foods to food insecure patients and improve health through nutrition. The definition of food insecurity is a household's inability to provide enough food for every person to live an active, healthy life. Currently, in the United States, there's 49 million individuals, including 12 million children, struggle to have enough to eat. In Allegheny County alone, the food insecure population is just over 174,000, or 14.2%. Food insecure children population is just over 42,000, or 17.8%. The food desert population is over 422,000, or 18%. A food desert is an area in which people live that is greater than 1 mile from a grocery store or a supermarket. Because people in food deserts usually rely on high-calorie, poor nutritional value foods from corner stores, as a result of this, the Pittsburgh area has the fourth highest rate of obesity among U.S. metro areas. Approximately 47% of Pittsburgh residents experience low access. And in comparison to food-secure households, food insecure households have 121% higher health care costs. So how and why was it developed? Because of these food insecurity statistics in the Pittsburgh area, Allegheny Health Network realized that there was a need and also a gap in services. We completed a needs assessment and collected data on food insecurity at the Diabetes Institute 2 months prior to opening. We used the Social Determinants of Health screening tool. Our model is a food is medicine approach, and we were able to tailor patients' nutritional needs based on their medical status. We were able to use ProMedica's model in Toledo, Ohio as our frame. With the support from leadership at West Penn and donation of physical space, we were able to secure a location. So with the data collection, plus food insecurity stats in Allegheny County and the physical space, we identified our first pilot site. We are the first program of its kind in a healthcare system in Western Pennsylvania. And to get the word out, myself, a doctor, went into various practices in the Bloomfield area and trained the staff on the screening tool, referral process, and the Healthy Food Center services. And to help us with this, a toolbox was created with specific criteria included for the practice's reference. So how are patients identified? Patients are identified using the Social Determinants of Health screening tool that's built into our electronic medical record Epic. Patients are asked 2 questions that address food insecurity. First question is, within the past 12 months, we worried whether our food would run out before we got money to buy more. And the second question is, within the past 12 months, the food we bought just didn't last and we didn't have money to get more. So the criteria for participation in the Healthy Food Center is having a provider with an Allegheny Health Network and screening positive on the screening tool. Once a patient has their referral, they will come into the Healthy Food Center and fill out a short intake form. The intake form tells me different demographics, typing of cooking equipment in the household, any food allergies or intolerances, if the patient is signed up for SNAP or WIC, and how many people are in the household. This intake form allows me to assess their nutritional needs and also better assist them with their food insecurities. Once the patient has the referral, they can visit the Healthy Food Center Monday through Friday. It's a drop-in service, so there's no appointment needed. We have the healthy food right on site, and a registered dietitian will help patients pick out the healthy food choices based on their medical needs. So whether they have diabetes, cardiac disease, hypertension, kidney disease, and having access to their medical record allows us to then tailor their nutrition plan and to provide continuation of care after their doctor visit. The patient will get 2 to 3 days worth of healthy foods based on their household size. This is also based on an 1,800 to 2,000 calorie diet. We partner with the Greater Pittsburgh Community Food Bank for our inventory, and we stock the Healthy Food Center with fresh fruits and vegetables, whole grains, low-fat dairy products, lean meats, and plant-based proteins. As far as canned goods go, it's all low sodium and low sugar. We also use the food bank as a connection to other resources in the area for patients. We can connect them with other food pantries, a Produce to People program, the Senior Food Box program, and the School Lunch program for kids. Patients are also offered nutrition resources like how to shop on a budget, how to cook healthy, and they can get many healthy recipes that correlate with the foods that we give them. They can schedule a one-on-one nutrition counseling session with a registered dietitian for a more in-depth education on their specific diet. Also, if they are not signed up for SNAP or WIC, we are able to fill out an application with them on site. The referral that their doctor gives them is good for once a month, up to 6 months. Then after 6 months, they will need a new referral from their doctor. The new referral every 6 months encourages patients to follow up with their primary care provider and stay engaged in their health care. We are also co-located and support the Catholic community of Bloomfield Food Pantry, in which we can refer patients for additional food if they live in the Bloomfield area. We have a lot of community partners to help support our efforts, and one of them is the 412 Food Rescue, which we receive fresh produce deliveries once a week. We also work with the Food Trust on connecting patients with the Food Bucks Prescription Produce Program, which are monthly $30 coupons they can utilize at local farmers markets and grocery stores in town to buy fresh produce. We are constantly looking into other resources that we can provide our patients with, like transportation and other support services. To get a better idea of what the Healthy Food Center looks like, here is a visual of our space. Patients are able to walk through the Healthy Food Center with a registered dietitian. The dietitian will help them pick out foods and at the same time explain the importance of the benefits of including fruits and vegetables in daily intake, the importance of low-fat dairy, and the importance of whole grains and lean proteins. We were lucky to have Highmark Health donate a 10-foot cooler and a 10-foot commercial refrigerator unit, which allows us to store perishable food items such as fresh fruits and vegetables and fresh meats that we can offer our patients. Here's another picture of our fresh items we offer our patients and also our recipes that we give patients. The picture on the left is our healthy recipe board, which patients can take as many as they want for free, and also some signage that we have in the Healthy Food Center. Since opening in mid-April, we've had 100 referrals ordered through Epic. 60 patients are currently participating. 35 out of 60 patients have signed up for one-on-one nutrition counseling, and 90% of the patients are following up for their monthly visits. For referral breakdown, 29 patients were referred from the Diabetes Center, 18 referred from primary care practices, 8 from Bariatric Center, and 3 from Hematology and Oncology, and 2 from Internal Medicine. This slide shows the various chronic diseases that patients have who participate in the Healthy Food Center. 37 patients have diabetes, 15 patients have hyperlipidemia, 23 patients have hypertension, 5 patients have kidney disease, 25 patients have heart disease, and 10 patients have other various diseases. Out of 60 patients, 32 patients live in a food desert. 50% of the patients participate in the Food Bucks Prescription Produce Program. 28 patients participate in the Supplemental Nutrition Assistance Program, also known as SNAP. 3 patients participate in Women, Infants, and Children, also known as WIC. And 7 patients participate in the School Breakfast Lunch Program. This chart shows improvements in nutrition-related labs. Patient 1 has had a 2-point drop in hemoglobin A1C. Patient 2 has had a 1-point drop in A1C and a decrease in blood pressure. Patient 3 has had a 3-point drop in A1C and a decrease in triglycerides panel and also a drop in blood pressure. So, positive outcomes. By providing the healthy foods, nutrition education, and support, patients are empowered to improve their health and overall wellness. They have a better awareness of how nutrition impacts their health. They have improved blood sugar management and increased access to healthy foods. So far, the feedback from the patients has been very positive. They're really engaged in nutrition information. An example of how we are impacting our patients. One of the patients is a 70-year-old woman with custody of her 2 grandchildren. She lives in a food desert, very little family support. She has multiple chronic health issues, including uncontrolled diabetes, and she had been skipping meals to cope with the food insecurity that her and her family have been experiencing. So after 4 months of participation in the Healthy Food Center, she stated with the nutrition education, access to healthy foods and recipes, support, and also connection to other food resources in the community, she was able to lower her A1C from an 8.6 to a 6.2. So future outcomes, by collecting and analyzing objective clinical data like A1C, BMI, weight, lipid profile, and also subjective participant data like surveys, patient stories, we'll be able to provide evidence of positive outcomes from the program. And as the program grows, we plan to collect more data so that we can track positive outcomes and gauge the impact the Healthy Food Center has on the community. Our future goals are to replicate the Healthy Food Center at each hospital location throughout the Allegheny Health Network footprint. Our next site plans to be the north side, and we're currently working on securing a location. So the goal is to meet the needs of the community with each one of these Healthy Food Centers. We also plan to expand services to patients, such as cooking demonstrations, community resources, and most importantly, we want to encourage other community organizations to help combat food insecurity in our communities. Recommendations. So based on evidence from adverse impact of food insecurity on health, developing data and healthcare costs, policymakers should maintain and strengthen their support for critical food safety net programs that help food insecure individuals. Farmers, food producers, and retailers should more actively participate in partnering on food security strategies and should also address food insecurity with their own organizations. Nonprofit organizations, those particularly focused on reducing hunger, early childhood development, education, and poverty relief, should continue to highlight synergies between food security and health. And I just wanted to leave you all with this quote as something to think about. Access to healthcare is useless without access to healthy food.